In this video, I'll be performing the nursing task, applying one elastic knee-high stocking. The supplies that you will need for this nursing task is one elastic knee-high stocking. Okay? Good morning, Mrs. Jones. My name is Julie, and I'm going to be your CNA today. The nurses asked me to come in and put on your stocking for you. Is that okay? Awesome. Can I look at your ID bracelet, please? Thank you. All right, Mrs. Jones. I just want to make sure that I'm performing the right task on the right resident. I'm going to go ahead and close your door for privacy. And I'm going to also close your privacy curtain. Okay? And for safety, I just want to make sure that the brakes on the bed wheels are locked and engaged. I'm going to go ahead and raise the bed at a height that's comfortable for me to perform this task, okay? Now keep in mind, the resident has to be in a supine position in order to perform this task. Okay, I think that should do it. So before we actually start putting the stocking on the resident's foot, I just wanted to show you or bring to your attention the heel portion of the stocking. Okay, the heel portion is usually blue. Sometimes, on certain stockings it may be white, but you should be able to determine where the heel portion of the stocking is. So before you actually place the stocking on the resident's foot, you have to turn the stocking inside out. If you do not turn the stocking inside out before placing it on the resident's foot, you will not receive credit for that step. An easy way to do this would be to put your hand inside the stocking, like so, and go ahead and pinch the blue portion or the heel portion of the stocking, okay, like this. And keeping it pinched, go ahead and pull the stocking over your hand, okay? And we have turned the stocking inside out. Now we're ready to place it on the resident's foot. Ms. Jones, I'm going to go ahead and uncover your left leg, since this is the leg that I'll be placing the stocking on. Again, you want to make sure that you do not overexpose the resident, so you only want to uncover the area that you're going to be working with. Remember, this is an elastic stocking, so it stretches, okay? While before putting the stocking on the resident's foot, go ahead and stretch it as wide as you can, okay, to make it a little bit easier for you to place it on the foot, okay? So I'm going to place it over the foot up to at least the heel, just like that, okay? It's over the foot and it's up to at least the heel. Now that I have the stocking over the foot, I'm going to go ahead and pull the remaining stocking over the foot and up the leg. Okay. Remember, every movement should be slow, gentle, and natural. Now that I have the stocking over the foot and up the leg, I'm going to go ahead and look to make sure that the blue portion or the heel area of the stocking is over the heel of my resident. If it is not, this is the time when you can adjust it, okay? The heel portion of the stocking has to be covering the heel of the resident. If it is not, you will not receive credit for that step. And that is a critical or bolded step, okay? You also want to make sure that there are no wrinkles or twists in the stocking. So go ahead and check. Lift up the resident's leg, be gentle, and make sure that there are no wrinkles and no twists. Okay? The opening part or toe part of the stocking can either be covering the toes or not. It doesn't matter. Okay? So when you place the stocking on the foot, if it's covering, let it stay covered. Okay? If it's not covering the toes, don't worry about it. Let it stay open. Okay? What matters is that there are no wrinkles, there are no twists in the stockings when you have completed the skill, and that the heel of the stocking is over the heel or covering the heel of the resident. Again, the resident has to be in supine position, okay, in order to perform this task, and this task is performed on a mannequin due to infection control reasons. Okay, Ms. Jones, I have your stocking on. I'm going to go ahead and cover your leg back up for you. Okay? I'm going to put your bed back down into the lowest prescribed position for safety reasons. Here's your call signal. If you need anything while I'm gone, just go ahead and press that button for me. I'm going to open up your privacy curtain and your door. I will wash my hands. Skill complete.